So who needs the all-on-4 procedure? All-on-4 is one convenient and effective method of replacing a full set of teeth. So quite often, it's used for people who have been wearing dentures for a period of time and are struggling with the effects of ill-fitting dentures or sore spots from dentures, and also the effects of long-term denture wear, which include the shrinkage of the jawbone and facial structure. So that's an obvious one. If you're missing your teeth, all-on-4 could be a potential solution for you. But all-on-4 implants can also be a predictable way of replacing full sets of teeth that are what we call terminal. So if we have a whole set of teeth that are heavily diseased, maybe from advanced gum disease coming loose from gum infection, or perhaps they have a whole series of different and complex dental problems, such as broken down teeth and root canal infections and gum problems and the like. Sometimes preserving sets of teeth like that can be unpredictable or even very costly or time-consuming. And for some of those cases also, all-on-4 can be a very effective and immediate way of replacing a set of teeth, not only predictably for a functional result, but also for a dramatic cosmetic or aesthetic rehabilitation.